Welcome to another lesson by BeWell. Shaping the health and care workforce of tomorrow. The BeWell project addresses the need to prepare the health and care workforce for green and digital solutions introduced in the European health and care systems to ensure they can respond to current and future challenges. In this lesson, we will clarify what is meant by telenursing and delve into telemonitoring and the use of apps in clinical practice. Let's get started.
The term teleassistance refers to a professional act within the relevant healthcare profession and is based on remote interaction between the healthcare professional and the patient/caregiver through a video call, to which, if necessary, data, reports, or images can be added. The professional providing teleassistance may also use apps to administer questionnaires, share images, or provide video tutorials on specific activities. The purpose of teleassistance is to facilitate the proper execution of healthcare activities, primarily carried out at the patient's home. Teleassistance is predominantly scheduled and repeatable based on specific patient support programs. Then, what is the purpose of teleassistance? Teleassistance serves both to collaborate with the doctor in managing the illness and to provide nursing support in terms of monitoring therapeutic adherence, health education, support, and monitoring of self-care, and collaborating with the family nurse in assessing healthcare needs. Teleassistance can make use of telemonitoring tools, which involve the remote measurement of vital parameters, signs and symptoms of illness, and other biometric data. This process occurs through manual data collection by the patient, who records this information in an app and transmits it to a dedicated telemedicine platform. Additionally, telemonitoring can take place through the automatic detection and transmission of data via dedicated platforms from implanted devices on the patient, for example, cardiac devices, glucose sensors, O2 rings for saturation monitoring. During the telenursing activity, the nurse views the transmitted data on the platform, interviews the patient, and gathers additional information about their health status, therapeutic adherence, and self-care level. The nurse identifies any clinical issues to be reported to the primary physician or any healthcare-related issues to be managed with educational reinforcement interventions or by referring new needs to the local care network. Telenursing can identify clinical problems to report to the referring physician, inadequate self-care, and provide educational reinforcement interventions if needed. The implementation of teleassistance. What does the team need? The first step involves acquiring the necessary skills for telenursing, specialized clinical skills related to the pathology for which the teleassistance service is activated, relational skills such as empathy, clarity, and conciseness. It also requires computer skills, knowledge of telemedicine platforms, telemonitoring systems, and cybersecurity. Step 2 involves choosing devices that can be used to achieve telemonitoring objectives, such as the ones you see in these images. Step 3 involves defining the activation and suspension criteria for the service. These criteria can be clinical and/or healthcare-related or may result from evaluation tools shared within the multidisciplinary care group. So, when does the nurse activate remote assistance? Patient frailty, for example, low compliance, no caregiver. Low adherence to therapy. Monitoring the effect of a new therapy. Monitoring of vital parameters for a short time. When does the nurse stop remote assistance? Recovery of clinical stability. Correct drug dosage and regular compliance with treatment. Patient follows the instructions given by the center, good self-care level. The team also needs dedicated clinical documentation, such as the use of shared assessment scales within the patient's care network and a system for sharing nursing assessments and interventions implemented. The gold standard is represented by the computerized outpatient medical record. Then some operative aspects, the process step by step. 1. Inform the patient, illustration of the remote assistance service and signature of informed consent. 2. Definition of the intensity level, regularity, type, number of devices. 3. Patient training and simulation. 4. Creation of personal credentials. 5. Planning of interventions. 6. Assistance during the process. 7. Sharing with the team. 8. End of the process and final evaluation. And now we talk about teleassistance in clinical activity. Using teleassistance reveals some positive aspects. Continuity of care. Reduction of waiting times. Develop self-care active role of the patient. Promote the independence of the assisted person. Promote interaction between the team and the patient. Retraining in the use of devices.
Which could be instead some possible obstacles to teleassistance. Lack of confidence with technology, setting less comfortable technical problems, increased risk of misinterpretation.
Let's try to tackle a clinical case. Hypothesis of activation of the teleassistance course in a patient with heart failure. Male hospitalized patient diagnosed with acute heart failure. Referring the patient to the heart failure outpatient clinic for take charge. Acquisition of informed consent. Evaluation by the multidisciplinary team. The decision is made to opt for remote assistance activation. The goals are patient education and self-care, detect clinical care needs, provide guidance for lifestyle adjustment, and recognize signs of instability and report to doctor.
So, we address these phases. Choose devices for telemonitoring. Training the patient to use devices. Definition of the path agreed with the patient. 2 contact per week for 1 month. The evaluations involves course of vital signs, level of self-care and therapeutic adherence, use of validated scales, sharing with the referring doctor. Continuation of low-intensity teleassistance then means 1 contact per week for 3 months and then a new evaluations moment. If the clinical conditions, self-care indices, and therapeutic adherence are adequate, then stop teleassistance.
In this lesson, we have delved into telenursing process. With a step-by-step approach, we have clarified the main aspects of the process. So thank you for your attention and see you next time.